No matter what kind of health insurance you have, Syracuse hospitals expect Medicaid cuts to impact everybody. President Trump and Republican allies passed sweeping Medicaid spending reductions that'll go into effect in the next few years. In Syracuse, leaders of two major hospital systems warn it will lead to longer emergency room waits and the elimination of some critical services. CBS 5's Connor White is in the studio right now. Connor.
Michael, industry leaders say it will be an expensive domino effect if nothing changes before new work requirements kick in. The new requirements mean less people are insured. The hospitals still need to provide them care, but then they're not getting paid. So the burden falls on other patients and the state of New York. This week, community activists gathered in downtown Syracuse to try to prevent the federal government from cutting Medicaid. Action spurred by dire warnings from local healthcare leaders.
The impact across Trinity Health New York will be just shy of about $30 million a year in reduced revenues.
Dr. Stephen Hanks, president and CEO of St. Joe's in Syracuse, is sounding the alarm. He says President Trump's cuts to Medicaid won't just impact Medicaid recipients, it will impact everybody. Even if Medicaid payments aren't there for hospitals, Dr. Hanks says they still have a duty to see their patients.
It will mean that we'll have to make some very, very difficult choices related to programs, related to services, and these will have an impact on access to care.
Upstate Hospital's leadership tells the I-Team they face similar challenges. So here's the problem. President Trump and the GOP in Washington are cutting about $1 trillion in Medicaid spending nationwide. That will begin to take effect next year. Then, stricter working requirements start in 2027. Governor Kathy Hochul's office predicts about 1.5 million people will lose coverage in this state.
If the health department does its job right, it doesn't have to be that high.
The Empire Center's Bill Hammond, an expert on all things when it comes to healthcare spending, says most Medicaid recipients are in fact already working. The burden lies with the paperwork it will take to prove people are still eligible, which isn't easy on a scale of this size.
And it could lead to some people falling out of the program even though they are working.
While he says no one can predict what the exact impact will be, he acknowledges that some hospital systems reliant on Medicaid could feel the heat. Dr. Hanks at St. Joe's says he expects the ripple effects to hit private insurance too. Less money from Medicaid means more pressure to raise rates on insurance companies like Excelis, further complicating a system of negotiations that put patients in the lurch this past winter.
I take it has changed in the exact wrong direction for you.
It has gone in the wrong direction, and it's going to have a domino effect, not just for St. Joseph's, but for every healthcare provider in the country.
Critical to all of this is that there's still time for this to change. Hospital and insurance lobbyists are powerful, and these changes are set to take effect around critical nationwide elections, including the presidential in 2028. But if nothing changes, the state may need to find billions, Michael, to keep these programs afloat in the future.